Welcome everybody to session 7 on Find the Link Parenting. We've had 6 amazing sessions. Thank you everybody for joining early. We'll be starting right away. Apologies for the late start. I'm just going to share my PowerPoint presentation where I'm going to introduce the speakers very briefly before they start speaking. And I'm happy to say that all our speakers are in the house already. Okay, so it's Find the Link Parenting. Our aim is to empower parents and raise change makers. And today's discussion is about parenting and the physical health of children. We have in the house a pediatrician, a surgeon, a pediatric surgeon, and a dentist. And the aims of the series is to enlighten, empower, inspire, and to give. And that's what these amazing people are here to do, to give us some more insight, to give us some more knowledge so that we can be better parents and so that we can empower and encourage others to be as well. Physical health and any health at all is a gift, and it's a great source of distress to a parent when a child is ill. We know how much sunshine and laughter children bring into a home, and we hear parents talk about Oga Madam when a little child has arrived on the scene. So it does cause a lot of distress when a child is ill in a home. And our speakers today, Dr. Busayo Babatunde, Dr. Emeka Nwachukwu, and Dr. Akinlabi Ajao will be doing justice to this topic today. And I will introduce them once I've pinned them on my screen. Once I've stopped sharing, I'll just talk about the sessions briefly before I take this off our screen. So next sessions coming up are parenting and mental health, parents with special children, parenting with challenges, and some more. And it's going to take us all to the end of July. So sit back and enjoy. There are a few sessions on the YouTube channel. Please watch them. I think we have sessions 1, 2, 3 on there already, and the latter ones will be joining them shortly as well. We have an active online group on WhatsApp. You're welcome to join. Keep in touch. They're going to be replays on YouTube, Twitter, Praising Child, Instagram, Facebook page, Living Your Dreams with the Praising Child, which is my motto. And you can send emails with feedback to tabletop@praisingchild@gmail.com. And our motto for the series and the sessions, which we believe is going to be our motto for ourselves and our children, is I and the children God has given me, we are for signs and wonders. Okay, so shortly now, I'm going to pin our speakers to my screen so that you can see them all. I was introducing Dr. Babatunde. Yes, so she happened to be my senior in medical school. She actually escorted me, if we know what that means at all, Nigerian parlance. She escorted me for about 3 months when I got to know her a bit more closely. She's an amazing lady. She has a master's in child health from the Institute of Child Health in the University College Ibadan. And she works as the head of departments in the Ekpe General Hospital in the pediatrics department. And she's going to be shedding some light on physical health for children from her perspective. And you're welcome, Dr. Babatunde. We have Dr. Emeka Nwachukwu, who is going to be our second speaker. He is a dentist. He's been for over 10 years. He's also a great friend. I don't mind his stern look. He's an amazing and rather jovial person, which we'll discover shortly, as he will be shedding some light on dental issues regarding children. He's been in the field of restorative dentistry, and he works in a private facility in the city of Lagos. And we have Dr. Akinlabi Ajao, last but not the least. He is a pediatric surgeon, and he is a great gentleman. He happened to be my classmate from the University of Ibadan about over a decade ago. Forgive our young looks. God has been good to us. Okay. He also has a master's in epidemiology and medical statistics, and he's also a lecturer in the University of Ibadan. And he's doing some extra work in the UK at the moment. So you're welcome, Dr. Ajao. So I'll just highlight Dr. Babatunde right now while she'll begin to share her screen. If Dr. Ajao and Dr. Mwachuku are happy for me to share their screens, I can, unless you want to, if you prefer to do that, please let me know, just send me a private message. Okay, Dr. Babatunde. Hola, Dr. Busbus. Please give us a smile now. This your face is scaring us now. You have to be user-friendly for the children's sake. We are all children here. You are muted though.
Okay, can you see my screen?
Yes, we can see your screen. It looks like you're starting from slide 5 though.
Okay, can you see my screen now?
Yes.
No.
Okay.
I'm at the beginning now.
Yes. We can see us.
I stole this from the WhatsApp. I thought it was really cool to start with this. Okay, all right. So can I start?
Yes, you may. Please go ahead. Thank you.
Should I start now? Okay, all right. So good evening, everyone. It's a great pleasure to be here. I've known Temi for a very long time. I actually can't remember spotting her. Just a few days ago, I was thinking that, how did I meet Temi? And I actually can't remember. It's like we've been friends forever. All right. So, yes, so today I'm talking about parenting and child health. All right. So we all know how distressing it can be when you have a child that is sick and you don't know what to do. And sometimes, a lot of times, it's distressing for us when children come to the emergency room and you see that, oh, there's something the parent could have done to prevent or could have done to intervene and ameliorate the condition. So, well, we'll talk about a few conditions here. All right, and I hope that we can learn something. So I termed it Look, Listen, and Feel. Okay, as you know, my name is Busayo Babatunde. Okay, all right. So I'm going to categorize children in 4 groups here. So the infants. So here I've grouped the neonates as the newborns, the ones between 0 and 28 days, the ones under 3 months, and then the ones up to 1 year. The under 5s, a very special group. There's a lot of work going under that group. The school age. So these are children between 6 and about 10 years. Okay. So these ones, yes, they overlap with the under 5, but they are stronger, they are more energetic, they run around some more, they give the parents some respite. And of course, our wonderful adolescents. Okay, so I'll talk about some common ailments. There are more than this, but I just thought I should highlight a few here. Okay, so I grouped them, the common ailments, the important ones by age. So for newborns and infants, jaundice, colics, and teething seem to be particularly distressing problems to the parents and to the pediatrician. So for me, the pediatrician, jaundice is distressing to me. All right, and then the other 5s. So yes, many of them come down with fever. Fever is the commonest complaint in children, followed by abdominal pain, then of course followed by cough, diarrhea, vomiting, and then we'll talk about convulsion. Thereafter, you tend to see more accidents and injuries. For example, this COVID period of children have been home, we've seen a lot of injuries, securing here and there, especially within in this school age category. And then the adolescents, they have their special conditions. So we'll talk about them. Well, not everything, but we'll touch a bit on some of them. So let me start with jaundice. Okay, for those of us who've had babies, we may be familiar with this. Okay, so that's the yellowish or the light greenish discoloration we see in the eyes of the baby or on the skin. Usually occurs within the first week of life, starting from about the 3rd to about the 5th day of life, and then it can last to the end of the week. It's usually a benign condition. It occurs because the babies have a lot of red blood cells when they're in the womb. And when they are born, they don't need all that cells, so they have to get rid of it. And the byproduct is a yellowish discoloration. So what makes it disturbing is because if it's excess, it can cross into the brain and stain the brain and damage the brain. So that is why it's quite important for the mothers and for the doctors, okay, who see newborns in the first 2 weeks of life. If you see jaundice in an older child, okay, it's in a more serious condition. So if you see jaundice in a 5-year-old, you cannot manage it at home. You must not manage it at home. You must present to the hospital and you must be satisfied. Nobody should reassure you that, oh, it is all right. Jaundice is never all right. Okay, so I think then it can also be caused by mismatch between baby and mother's blood, exposure to certain substances, infections. Okay, so those are some of the things that will cause jaundice in newborns. Well, for every newborn, it's advised. Any newborn can have jaundice. Most of them will have jaundice. Very few, it will not be obvious. Okay, so for when you have a newborn, you should nurse your newborn in a well-lit room. We train in Ibadan. Um, they're very fond of nursing the child in a fortress. The windows are down, the doors are locked, the windows are shut, everything, the blinds are down, so it's dark. So they don't see the child until the 7th or the 8th day when they bring the child out for naming, and then they see what we call an MTN baby, and they start saying, "Oh, this baby is very fair. The baby is very fair. The baby is," and then the baby is twitching. And so it has gone on for a while. So we advise that you nurse the child in the newborn in a well-lit room. Draw up the blinds, especially in the mornings before the hot sun. I live in Nigeria, so we are familiar with the hot sun. So drop the blinds in the mornings. You can drop it by let's say 9 or 10 once this hot sun starts to stream in. This enables you to see the child, so you can detect the jaundice very quickly. And also, the sunlight streaming in is therapeutic because we use light that it was discovered from sunlight that was it was light that was used to treat jaundice in newborns, at least in the mild stages. So you can drop the blind so that some sunlight streams in. But if by the time you notice jaundice in this newborn, please go to the hospital. Don't draw sunlight anymore because you don't know the degree of the jaundice. So it has to be tested. Then they can tell you, oh, okay, this is mild. You don't need to do anything. Just come back and then check again. Or they will admit and put the baby under light. Or, oh, this is so bad, we have to exchange blood right away. Okay, so once you see jaundice, please do not delay. Then for every newborn, avoid substances like silver bed. It's very common here. We have what we call a jogba. Baby is born, you have a basket full of all sorts of things. The baby is not sick, but grandma and everybody have brought all sorts of things. So we have silver baby campus, camphor balls that we used to wrap the baby's clothes. Okay, these two are implicated. Salicylate ointments or even any medications that has not been prescribed, avoid because they may tip the child into jaundice and it would progress very fast. Like I said, if you ever see jaundice in a newborn, just go to the hospital. So the next ones, I call them normal inconveniences. Okay, babies are not sick, but these are just I call them the rite of passage. That's the almost every baby will have. So colics, yes. For those of us who had babies, yes, we know this thing. I remember when my sister's first son was born, she would say, "Bolu sukumpa anybody," as in the crying was not here at all. The boy is 20 years old and he did not die. Colic did not kill him. So yes, colic did not kill anybody. So it's not a disease. We usually call it gas. All right. Excuse me. We usually call it gas. Though we are not, there's the facts are not that certain. We don't know whether it's really gas because some people have done research that at the time the child had the colics, they did x-rays and the abdominal gas was not particularly more than it should be. Some people think it may be some form of intolerance to milk. And then some people think maybe it's the movement, the gut movement, maybe it's rather fast, so it causes discomfort. Or whichever way, it's a benign condition. It's often more distressing to the mother because she doesn't get any respite. The child usually it may start maybe around afternoon or evening. The child can cry inconsolably. Nothing stops the crying, and that can be really distressing for mothers. I've had mothers come to the hospital back to back because the child was having colics, and some of them are asking for something to sedate the child just so that they can have a moment's peace. All right, it's often milder with breast milk than formula feed. Does not mean that babies on breast milk will not have colics, but the severity may be milder. Okay. So what do you do? There's really nothing to do. Okay, like I said, it's a benign condition. But you may burp the child after feeding before putting the child down so that some of the gas is let out. It can go both ways, go up or down. All right. you often find the comfortable position. They call it the colic position. I remember once a woman came into my consulting room. She came because she was having colics. And the moment she walked in, she just handed the baby over to me. She had enough. And without thinking, I didn't even, I was particularly, it wasn't if I done any research or anything. Without thinking, I just placed the baby on one lap and had the head drop over my hand, and the baby just fell asleep. The woman was shocked. She carried the baby out of my consulting room like that, in that same position. So we're like, oh, now we found a position that works for this baby. So you may need to try different positions to find what will work for your baby. They call it the colic position. Hopefully you get some relief. All right. Well, anticolics, plus or minus. Everybody knows gripe water. It's been alive long before all of us. I think as far back as 1870 something. The initial preparations had alcohol and sugar in it, but of course, with time, people started, looking into those things. Basically contains herbs, things like ginger, licorice. I'm trying to remember now. I can't remember the chamomile or something like that. So, well, neither here nor there. It often doesn't hurt the baby, so we don't say don't give. We don't say give. Some of them, you have the Infacor, all sorts of things, simethicone. They work like buscopan, so they are like antispasmodics. So they reduce the movement of the guts, so that the child gets some relief, but usually not long lasting. Yeah, lasts maybe a minute or less, and then the child is back crying again. But often doesn't hurt, so we tend to look away. All right, teething. Most babies start to erupt too from about the sixth to the eighth month, and often that causes some discomfort for the babies. And around that time, that's when the babies start to move. By 6 months, they are sitting without support, so they can reach out for things. By 8 months, they are crawling, so they can actually move around. And then because they have this gum that is itching, so they can actually pick things and put it in their mouth. And because they are close to the ground, they can inhale stuff. So that's the time when they can develop diarrhea, vomiting, cough, catarrh because of their movement around. So most times by association, many mothers will say, "Oh, the child is sick because the child is teething." I had a woman; she lives in Banana Island, as in Banana Island in Lagos. So very rich, very arrogant. In fact, she came with heirs, and she had these twin daughters, and they had fever. So I did test, and I was like, "Oh, they probably had some bacterial infection. They needed antibiotics." And she rolled her eyes and said, "It is just teething that is wrong with the babies." I didn't bother arguing with her because she had agreed to take the antibiotics, so we were fine. There was no need to fight. Okay, so yes, so these things happen around that same time. So we have many people believing that, oh, that is why, because of the eruption of the teeth, that's why the child has fever. Okay, so what do you do? Give paracetamol or some mild analgesia. So I know we'll talk about paracetamol in a bit. Some people have some tricks that they do. They put flannel, a wet flannel, in a freezer, so it's frozen and they give it to the baby to suck. So that helps to soothe the gum. Some people use maybe carrots, a frozen carrot, and give the baby to suck. But be careful, don't give something that is small enough to choke the baby. So you can use the flannel of the carrot, something big enough that won't go to the back of the throat, and then the child can put it on the gum and then continue to suck on it. It gives it causes some soothing and gives some relief. Okay, so I'm going to jump from infants to the older ones. Okay, because of time. Okay, but I'll come back to the younger ones if I have some time. So let's talk about menstrual pain. Now, everybody is familiar with this, whether you're male or female. If you're male, you have a sister or a daughter or somebody. It's very distressing, very embarrassing. Accounts for loss of hours from school, from work. But it's also benign. Never kills anyone. It can vary in intensity. Okay, most times mild analgesia works. What causes menstrual pain? Well, there's still research going on that. People talk about hormones, some certain kinds of hormones. Some people are found that okay, when they drink a lot of sugar, their flow is heavier and they have more pain. But all these things are associations. We are not really sure whether this is what causes what. Okay, so for your nieces, for your daughters, for your friends, you can help them. You can help them get some mild analgesia. If they require stronger analgesia, be mindful not to take them on empty stomach. I've had to unravel cases of adolescent girls coming down with peptic ulcer disease, asthma, and that their asthma is difficult to correct. Peptic ulcer disease is just not going away, and then we come down to menstrual pain. They are using Feldin. That is what is the culprit, Feldin. They're taking Feldin. They're not taking. They're taking it on an empty stomach because they're having pain. They won't eat. They just want to knock out the pain. It causes ulcer. And for those of them that are asthmatic, it worsens their asthma. So many times I have to start telling their parents and counseling the girls that, okay, you need to tail down this strong analgesia. And then you can encourage them to eat well, hydrate well, take a lot of fruits and veggies so that they can empty their bowels. They empty their bowels, they empty their bladders. It makes them feel less congested and also makes them feel better. All right. And then they can supplement with folic acid, plus or minus iron supplements, okay, because they are losing blood at that time. Iron supplements during that time, if you use iron during the period, it makes the flow heavier, so you may want to wait. But folic acid is fine. As a matter of fact, let's take this away. Any girl in the reproductive age group should take folic acid. Any girl, this is a part, this is not for menstrual pain, but please take this away. If you have any girl in the reproductive age group, let them take folic acid. Practically all pregnancies are never planned. People just get pregnant. Okay, but if they're taking folic acid, the defects that are associated with not taking folic acid can be taken care of. Okay, because by the time you know you're pregnant, that period has already passed. So please encourage your nieces, your daughters, your wards to take folic acid from the moment they start to menstruate. All right, so if you have a girl whose period, let's talk about danger signs now, whose period is very heavy with clots. Okay, and so many times you see them, they are weak during their periods. Or you have one that has prolonged flow, they are bleeding many days on end, 8 days, 9 days, a week, they are still bleeding. Oh, sorry, more than a week, they're bleeding up to 10 days, 2 weeks, they're still bleeding. Or they have the cramps are severe throughout the period. Many times the cramps get severe, get milder by the third to the fourth day. For those who bleed up to 5 days, gets milder. But some that their cramps are severe throughout the period, or the period is irregular, has a period in January, no period until April, then another one in September, like that. Or you have a child up to 14 years who are still not bled. These kind of categories, these are danger signs. You need to see a doctor. This is not the one to be taking iron or folic acid or hydrating. This is the one that needs to see a gynecologist. All right, so let's go on. Let's talk about accidents. Yes. So common things that happen here in Nigeria, we see a lot of kerosene ingestion because people buy kerosene in plastic bottles and they put water. So their children see it's a clear substance. They think it's water and then they drink it. Or people put tablets where children can see iron tablets, antipsychotic tablets like haloperidol are particular culprits because they are brightly colored. And then you see children taking we still had one child about a month ago that ingested a lot of haloperidol tabs. Well, our uncle's tabs, so we have to be looking for echinitone everywhere. Okay, so remember to put your medications out of reach of children, out of reach where they can reach. Lock it in cupboards, have the keys taken away. Don't be helpless. You have to take charge of these things. Okay, put your medications in tamper-proof bottles. I think bottles like azithromycin, I think, yes, have these tamper-proof caps. So you can turn it over into a tamper-proof bottle and label it so that you know what's inside, so that your children may not be able to open it. Okay, the older ones typically will accidentally swallow tablets. Also, things like colorful camphor balls. I've seen that happen before too. They will think it's sweets. Okay, so take them out of reach, or if you have children that are older enough, you can actually tell them that these are not, I've had to do that before, these are not sweets. And after that, none of them touch this. So be careful of colorful things that children can put in their mouth and swallow. Then, like I said, don't put chemicals in containers that are usually used for food and drinks. So what do you do? For the non-volatile substances, most times activated charcoal can serve as first aid, and thereafter take the child to the hospital. But if a child has ingested something caustic or something volatile like kerosene, do not induce vomiting because the child could aspirate and then it will cause problems with the lungs, or it could burn the child all the way up and you have a big, big, big problem. We have a pediatric surgeon in the house. I think they will tell us more about this. Okay. And then in that situation, please immediately go to the hospital. And note, every accidental ingestion would require admission for at least 6 hours. So when you get there and it's nothing, okay, they've removed the substance, they will still require at least 6 hours of admission. So please cooperate with them. The reason is that they want to be sure that there's no complication. Paracetamol is also something that children tend to take a lot of. Then be sure that this is not a suicidal attempt. So this is another thing you have to be certain that this was accidental, not intentional. Okay, so other things, bites. So dog bites, animal bites, human bites as well. You have any case of bites, this person must take tetanus, antibiotics. Okay, if you have a dog bite or a bat bite or scratch, even a dog scratch, you must take anti-rabies. You must take anti. I've seen sad cases where a dog scratched a child and they took the child to the hospital, and the hospital said, "Oh, since it was not a bite, it's okay." And the child developed rabies and the child died. So please, even scratches, the child must get anti-rabies. Snake bites, tie a tourniquet, but most snakes around where we live are green snakes. Usually don't have fangs. So if you don't see actual bite size, bite wounds, it may actually be a green snake. But anyway, take the child to the hospital because you don't want to take chances. You have injuries, children fall and they bleed, so apply pressure. Apply pressure. If it's a limb, you can elevate that limb above the level of the heart to slow down the bleeding. Calm the child, calm yourself, calm the child. Give the child some paracetamol to ease the pain. You can give the child some sweets or some lollipop just to cheer the baby up. Okay, play some music for the child to calm the child down. As you're doing that, you're calming yourself. Okay, and but if you have a serious injury, the child is unconscious, please stabilize the neck and then move carefully to the hospital. For those of us living in countries where you can call for the ambulance, okay, that you can just keep the person stable until the ambulance comes. Okay? But for those of us who don't have ambulance services as uh, that much, keep the neck stable and move carefully. You must remember to be calm. Most times, you cause more damage in the process of panicking. Okay. Yes. So first aid. I recommend that everybody takes a course in first aid, CPR, life support, one way or the other. Okay. I think I would help a friend of mine that does this in Nigeria advertise. I'll send the link to Timmy. Okay. So let's talk of choking. The first fatal case of choking I ever came across was I was in secondary school. I think I was in some 3GS3 or something. And I had this friend, she was in GS1, and she said her cousin died, that they were eating, and then she couldn't breathe, and then she died. We were rushing her to the hospital, and then she died. Okay, and then later we discovered that the girl actually choked, and it was so sad because they could have actually helped her, and then that would have been it. So if you see someone who is old enough who does like this, okay, please look at me. Person does like this. This is what we call the universal choking sign. All right, and the person is unable to speak. Okay, but if it's a young child, like a baby or an infant, the child can't do like this. But you see that the child is unable to cry, is unable to phonate. Okay, and the child can steadily become blue and then become unresponsive. For infants, I'm sorry I couldn't get a clearer picture, but you can go online and you will see what you're supposed to do is to do 5 back slaps and 5 chest thrusts. Most times, if the child is still responsive, the back slaps usually work. So turn the child on your lap. Stretch your lap down a bit so the child's head is a bit slanted downwards, and then slap the child forward. Slap the back, the middle of the shoulder blades. Slap it sharply and then forward. Be mindful that you don't slap the child the back of the head. It usually works. Okay. And then for the helmet maneuver, you have to kneel down, kneel behind the child, put your arms around the child, and then forcefully thrust inward. It helps to push out the object that is choking the child. Whatever you do not put your finger into the child's hand, into the child's mouth to sweep if you can't see the object. If you open the child's mouth and then you look inside, you can't see the object, do not do a finger sweep. If you see the object, then carefully pick it out. But if you can't see the object, don't put your finger inside because you can dislodge it further inside and further and then worsen the condition. And of course, call for help. Immediately, somebody should start dialing for help. Call 911 if you're in a country that can call 911. If you are in a country that can't, somebody that has a car should start firing off the car or call for someone who knows how to do these things. Okay. Then for unresponsiveness. So you find a child who has fallen, okay, or just falls right in front of you, and the person is not moving, the chest is not rising, and or if you know how to feel for a pulse, you can feel for a pulse and you don't feel any pulse, or you put your ear to the person's chest and you don't hear the heart beating. Please don't drama. I had a father about a couple of months ago. The child had, we don't know what it was. Well, okay, I know what it was, but the child got up in the middle of the night and vomited, and the father took him to his side and took a sleep next to me, and he was watching him. And then suddenly the child stopped breathing. You will not believe it. This father started doing CPR. He started pumping the chest. They carried the child into the car, told the wife, continue to push the chest. By the time they got to the hospital, this child had recovered. And when I came, I saw the child. I thought they came for vaccine or something. I mean, I was like, oh, why are you here? And they said the child was unresponsive, that the father was doing CPR. The child actually had arrhythmias. His pulse rate was irregular. We had to call the cardiologist. And it was like COVID period when people were clapping for the health workers. We were all just clapping for them, and it was just, it was just nodding and taking the accolade. I was like, Daddy, well done, you saved your child. I mean, that day we were all so proud of it. And I remember another case. So this was even a nurse. This father was not a health worker. He knew nothing about BLS. He just said, oh, all those WhatsApp messages that mother sent is that he remembered that. Now this was a nurse. Her child was in the daycare center, and then maybe he aspirated or something, and then they rushed the child, and she was just crying, hey, hey, and I remember I was like, Madam, do something, and we couldn't save this child. We couldn't save this child. They put her aside, she was just screaming, and I was like, oh my God, leave the drama, do something, but it was too late. By the time they got to us, the child had brain damage. We just kept the child nicely for some time, and eventually we had to let the child go. So do something. Whatever you do, you find someone who is unresponsive, put your hand against the chest and continue to push. Whatever you do, if you know how to do CPR, if you know how to give first aid, go ahead and give it. Okay, but while you are doing that, call for help. Call for help. Call for help. Yes, see these children, they know what to do, and they're doing it. Tell me, look at this picture. You're not looking at.
I can see
All right,
it.
so
They are
let's go
doing
to
well.
the ones that we're more familiar with. So I talked about they are doing well. I talked about fever. So I encourage us all to have thermometers at home. We have the digital one. I should have brought mine so I can show you. We have the digital one that when you put it, it would beep when it's done. We have the infrared. Okay. I don't advise you to get the mercury one for many reasons. Usually health workers I don't have to use it. And then if it breaks, the mercury can leak out and then it's poisonous. So get the infrared or the digital. Okay. So using your hand, doing like this and say, oh, the child has fever, may or may not, may or may not. Okay, so get a thermometer. Usually, when temperature is above 37.5, they say this person has fever, and it can make the child very uncomfortable. Usually, they're irritable. They start to breathe fast, and if it gets high enough, they can convulse. Okay, often it's caused by infections, malaria, often for the purpose of this topic. So what should you do? Expose the child to fresh air, remove the clothes. You can bath with tepid water, not cold water, because the difference in temperature will be too much, too soon, too fast, and then the child starts to shake. Okay, that can even worsen the condition. So use tepid water. It's lukewarm, or even it's even colder than lukewarm. If paracetamol, we call it acetaminophen. Okay, so I know there are different brands. It's Tylenol, Calpol, I think Advil. Okay, so know the different brands. If you don't know the dose, check on the leaflet. So usually they'll tell you according to the child's age or weight. If you have tablets, if you don't have a syrup, if you have tablets, they also work very fast. So I've put some like a prescription chart here. So your child is less than 5 years, you can use half of the tablets. The child is up to 10 years, you can use a tablet. Child is up to 10 years, you can use two tablets. Okay, so you can crush it for a child that can't swallow, and then put something sweet and then give it to them. And of course, you have to find what's causing it. For many children, it's usually viral. They have some runny nose, usually good, but 2 days the child is still having fever. Take to the hospital. All their danger signs. All right. So the child is. Do I have a slight danger signs? I'm not sure. So you have a child that is not breathing well. A child that the color is looking awful, is vomiting and stooling so much. That kind of child, don't treat at home. Immediately go to the hospital. Convulsions. So you have a child that suddenly starts to jerk or starts to stretch and is just staring straight ahead. The eyes are rolled up. The child is not talking. Okay. Most times somebody convulsing does not communicate. It's very scary. I remember this happened to my younger sister. I was 10. She was 2. I've not forgotten till today. It was very scary. Okay. It's usually caused by cerebral illnesses. All right. Or an infection of the brain. Sometimes it's caused by epilepsy. There are some children that have what we call a seizure disorder. All right. So those ones don't often have them fever before they convulse. So what should you do when somebody is convulsing? Hold that child down until the jerking stops while you're calling for help. Don't start to force something to the person's mouth or force his mouth open. Don't put the leg inside fire or inside hot water. I still see that in the general hospital. They put the leg inside hot water or fire. And whatever caused the convulsion, they don't treat him in a day or two. And then now we start battling burn injury. So hold the person down until the jerking stops. If you can move the person to a health facility as quickly as possible, they have ways in which they abort the convulsion. And if this person is epileptic and you know that this person is epileptic, you may have to go to see a doctor so that they can review the medications. It may mean that this child has outgrown the dose of the medication he or she was taking before. So you may need to either increase, or are you taking something else that is not making the medications that are work well. Remember to go to the hospital for that. Diarrhea and vomiting, you all know this. I'm not going to go into what's causing it. Let's talk about what to do. All right, so whatever you do, please don't give flagyl. In Nigeria, that's a very common thing. Somebody is vomiting and has diarrhea, they're giving flagyl. No, you need to replace the fluid the person is losing. Give ORS. Okay, if you don't have ORS, you can use some homemade remedies like rice water, curry water. Pedialyte is something that is bought over the counter. It's very close to ORS. It tastes better, so some children will accept it from you. Please don't give fizzy drinks. So this is not time for Coke, Fanta, Sprite. Don't put salt inside Sprite and give. Gatorade was very common in the US, I think. No, it is not ORS. So fizzy drinks, sweetened drinks, totally contraindicated. Don't try to stop the vomiting or diarrhea with that stop vomiting. They have their problems. You need to replace the fluid. But if it's persistent or it's voluminous or this child is getting weak, you need to take the child to the hospital. If the stooling or the vomiting has blood, you need to go to the hospital. If the vomiting persists for up to 2 weeks, you need to go to the hospital. What I advise to prevent diarrhea vomiting, because oftentimes it's caused by food contamination, hand, food, and water hygiene. Hand hygiene, everybody knows that now in days of COVID. Food, store food properly, preserve food properly. Don't say, oh, the rice is hot, the stew is cold, and it will mix together. Don't do that for children. They will stew their barrels out. Water hygiene as well. So I said that's pretty straightforward. Cough, I'm trying to run now. Cough, very common, is not a disease on its own. It may mean just common cold. It may mean asthma. Those are two different things. It's a reflex, can be caused by a myriad of things. We usually don't advise our children below 4 years be given cough syrup, especially those with codeine, because it can worsen their condition. It can actually make them, because, and then cough expectorants, because they can't expectorate. So they tend to swallow it and then it settles and then it breeds infection in them. So it can actually worsen their condition. For those of them with some nasal congestion, saline nasal drops work fine, and then I use it at night more often so the child can sleep better. There are homemade remedies that I use: honey, lime, tea, ginger, peppermint. Don't give children below 2 years honey. They're not able to metabolize it. I'll say that again. Children below 2 years. Hello.
Yes, we can hear you.
Am I talking to myself? Hello.
Yes, we can hear you.
Okay, because your face is frozen. All right. Okay, so don't give children below 2 years honey. They are not able to metabolize it. You can use warm water gargle. You can steam, but do be careful. The one that we do here in Nigeria, where you put hot water in a bucket and then you put your head over, it causes accidents in children. So you can stay in maybe like a bathroom and run hot water from the tap and then the steam. So you inhale it together. Okay, so stay with the child there so that you don't have burns. So I've talked about danger signs. You have fever, you have fast breathing, child is not eating, or child is lethargic. Please bring the child to the hospital. Those are danger signs. Self-medication is not recommended. Okay, so my final slide. Do pay attention. Not everything is cough and catarrh, and then It's not everything you can explain away. So you see changes in your child. A child that normally was normal, okay before, suddenly is sleepy, suddenly is lazy. The tendency is to shout at that child. If it's an adolescent girl, she may be having iron deficiency because now she's bleeding. She's having her periods now. She's having iron deficiency. They may have chronic diseases. They may have a heart problem, something that is draining away all of their red cells. So they tend to tire early. So you see a child that was doing well in school and now the academic performance is declining. That's not the time to be shouting. That's the time to investigate. A child that was dry during the day and at night now is bedwetting. May mean a bladder infection or perhaps child sexual abuse. So if you see any changes, don't be quick to explain it away, investigate. There may be somebody may be tormenting the child. It may even be bullying in school by the teacher or by other children. So always look into changes, abrupt changes very quickly. And then remember that you may also have some more sinister things like drug abuse. All right. So honorable mentions, I can't touch them, but I am aware we have things like constipation. Okay, so watch your diet, watch your fruits, fiber, and water intake, bladder infection, bedwetting. You may need to set time. Okay, and keep waking the child up at certain times, alarms, rewards. Okay, try not to punish. Try not to punish. Sexual abuse, a whole big topic on its own. Okay, and then rash. I was so happy I didn't have to discuss this, so we won't leave here today talking about rash. Feeding and nutrition, and of course, growth and developmental challenges. These are things that I would have loved to talk about, but we really don't have the time. All right, so thank you, and I'm glad to have been here.